News about COVID-19 vaccines are everywhere in the news and on our social media accounts, so it's only natural that your child may have questions and lots of them. I'm Jessica Salazar with Overland Park Regional Medical Center, a part of HCA Midwest Health. We're chatting with Dr. A. Gabriel Schiffman, Medical Director of the Pediatric ER at Overland Park Regional Medical Center, about helping to explain what can be a very complicated topic in simple and reassuring terms. Welcome, Dr. Schiffman.
Thank you for having me.
Yes, absolutely. So now that the vaccine is available to kids ages 12 and older, they may have lots of questions. And how do parents and caregivers approach this topic?
So I think just with all of the news and fear and just uncertainty with this new vaccine, it makes sense that there are questions both with the parents, with friends and families, with caregivers, with the kids themselves. So it's very natural to have questions and concerns. I think that every parent should make the best choice for themselves with being the most educated as they can be. And so telling your kids that this is a safe vaccine, it's been studied for more than a year. Even though this is a new vaccine, this is not a new technology. The mRNA technology has been around for 40 years. It's a safe and effective way of delivering vaccination. It's been studied extensively in the adult population. It's been extensively researched in this age range from the 12 to 18-year-olds or 16-year-olds and with the Pfizer. And kids have been involved in the research. They've been test subjects. So this is a very safe vaccine. And so giving them that information that this has been a studied vaccine, it is safe to be given. There are very, very little side effects. The most side effects that we see are pain at the injection site, soreness the following day, or some slight fever. But then tell them, this is something that can get you back to normal. We've been living this new reality for the past year and a half with masks and social distancing and no travel, and not seeing your families and friends and your grandparents and stuff. And so it's a way to encourage your children to get this vaccine or to come back to some normalcy again. With the vaccine, you'll be able to travel, you'll be able to see your friends and hug your grandparents and go out to restaurants and all that stuff. So I think just having the discussion and asking them, what's your fear, what are your concerns, and being educated enough to let them know that this is a safe and effective vaccine.
I think having that conversation with my teenager, keeping the benefits team centric really helped.
Yes.
You can go spend the night at your friend's house and you can play on the basketball team again, and you won't have to quarantine, and you won't have to miss out on sports games and practice. And I think that was beneficial to have that type of conversation with him being 12, almost 13 years old, keeping it at that age level.
Yep, I agree. My children are below the age range, but my niece and nephew are in that age range, and they called, and their mom called, and that's exactly what we did. We said that did you start playing sports again? I have to worry about this, and if you are, once we're all vaccinated, kids or adults, 2 weeks after the last vaccination, you don't have to quarantine if you're exposed. You don't have to test if you're exposed. So it's a game changer. It really will put us back to what we're used to prior to this COVID-19 pandemic.
This is great information to help start that conversation. My teenager really, he took it upon himself to do the research, and he made the decision really on his own to get the COVID vaccine. He and 2 of his friends, they made appointments. All 3 of them went together. And, how does this also help parents begin to have the conversation with their, teen about taking control of their own health care?
Yeah, I mean, I think it's a great opportunity. I think it's great that your son had the initiative to do all that. It speaks volumes. I think that it is a great opportunity where you can have a discussion. You can ask them, what are your concerns? Let's work through this together. With today's day and age, with the internet and the accessibility to all that information out there, steering them in the right direction of where to get their information. So I would steer away from Facebook. I would steer more towards the CDC or government websites to kind of get the best information, or Pfizer, or Moderna's, or Johnson & Johnson's websites themselves, just to get the best information out there, because there is a lot of information that may not be as accurate as it should be on the internet. So having that discussion, saying, why don't you do some research? Let me help you, guide you through this. And then having the tools to navigate these decisions will, I think, promote them to make decisions in the future. I mean,
Mhm.
Gardasil is another vaccination that's, it's a teenage vaccine that, I think it's a great opportunity to talk about that too we're talking about other vaccinations. And it's the beginning. It's a great opportunity to begin that process of giving them the power to make these decisions for themselves.
Mhm. I mean, he went and he made the appointment himself. He made his own follow-up appointment. He keeps his card. So I feel like this was kind of a great teaching moment in, okay, this is how you have to, take control of this. And,
Yep.
You're going to start making your own doctor's appointments and,
Yeah.
keep track of your own medicine. This is what you're going to have to do, when you're a grown up. So, yeah.
It's a great opportunity. It really is.
So we do have a few questions submitted from our Facebook viewers. One viewer asks, are COVID-19 vaccines safe for children?
Yes. So the answer is, yes, they are. I think very soon they'll be doing more studies for the lower age range. From what I've heard from the CDC, that they're actually going to go, the next group of children will be 2 months to 6 years, will be the next study group. And then the last group will be the 6 years to 12 years. So the answer is yes. The research has been done for 40 years on this type of vaccine. It's just a matter of getting through the red tape and doing the proper research in each age group. But if it's safe for adults at this point and safe for the 12-year-olds, 12 to 18, it will be safe for all children. It's just a matter of time going through the proper channels and the proper testing and studies in order to get it approved by the FDA.
Our next question is, my child had COVID, should they still get the vaccine?
It's a great question, and the answer to that is also yes. So unfortunately, there's a lot of variations and of variants of the of the disease out there right now. There's in India, there's tons of different strains. And if you get sick with COVID-19, you're getting sick with one of those strains, so one of those variants. What's great about the mRNA vaccine is that it covers for all of these variants. So it has technology to have the understanding of the base of the virus, or not all the different little changes, but the base of it, and it can prevent you from getting any of the other strains. So if you get COVID-19, the disease itself, you can get it again and again and again and again, depending on what strain you get, just like the common cold. Every time you get sick with a common cold, you're getting a new strain of that common cold, because our bodies learn just with that one type of strain to be effective at preventing us to get it again. So that's why we get colds every year, because that strain changes. Same thing with COVID-19, that if you do not get the vaccine, you have the opportunity to get sick over and over again with COVID-19. So yes.
Are the side effects any different for children than adults?
Not really. The studies have said that it's still pain at the injection site, soreness in the arm the following 24 hours. There's a slight increase in fever side effect as compared to adults, but it's nothing major. It's nothing threatening by any stretch. In my opinion, it is worth the side effects to have for 24 hours, and then preventing yourself or your children from getting COVID-19 in the future.
What if my child is exposed to COVID-19 after they've been vaccinated?
Yep. So we kind of talked about this just a little bit ago. So if you are exposed 2 weeks after your last vaccination, so after your second dose, you are protected. You are considered 100% protected. 100% is a not true number. It's about like 97% now protected from COVID-19. And the recommendations from the CDC is that you do not have to be quarantined, you do not have to be tested if you are exposed to someone who has COVID-19, if you are fully immunized, and that is 2 weeks after your last vaccination. Now, if you are exposed, you develop cold symptoms and you develop, fever, I would definitely do what you normally do to prevent spread of any kind of disease. So, you should stay away from people. You should, take measures to not spread it. So stay at home, Tylenol and Motrin, lots of fluids, rest like you would with any cold. But all that stuff that we were having to do prior with quarantining and testing and retesting, that is no longer recommended for someone who is 100% vaccinated.
How will the COVID-19 vaccine change socializing for my child?
Well, I hope that it gets everyone back to normal again. That's the whole plan. And I'm really excited about how fast this has gone. I mean, pandemics do not in the past. The past one we haven't had one since 1918 with the Spanish flu, but it's crazy how quick we were able as a world to develop a vaccine to put a stop or slow and then eventually a stop to this virus. So my hope is that if we get enough people, it's about 75% would be considered herd immunity. We won't have to worry about COVID-19 again. So I think that it'll go back, pardon me, to normal. Where, I mean, I know it's a long time ago, but we'll remember that you can go to restaurants and you can hug your friends and your family, and you can travel on airplanes without masks, and all this stuff that will become, which is now kind of the old reality, back to the new reality again. So I think that if we can all do this together, we can see a return to normalcy real soon.
Now, this next question is a situation that I'm in. Should I be concerned about having my older child vaccinated around their younger sibling who is not vaccinated?
So the vaccination part, no. So by having your older kids vaccinated, there's no risk to the child who's not vaccinated. So that you can't catch the disease from a vaccine, from the vaccine or from the vaccinated person. Now, the recommendation from the CDC is if you have anyone in your family who is not 100% vaccinated, so that means any kid under the age of 12, they are at risk of catching the disease still. We're in the same situation. So, the adults in the house are vaccinated, my children are not. So you have to stick to the old recommendations with your whole family, because there are people in your family who are not vaccinated. So yes, you do have to wear masks. You have to be more careful. Those kids who are not vaccinated are at risk of catching the disease. I will tell you from all the studies out there that children, the younger children, especially under 12, have a very low risk of spreading the disease. They're much more likely to catch the disease from someone older. So by vaccinating the older kids, from vaccinating the parents and the grandparents and everyone, teachers and coaches and whatever, the chances of them getting the disease is very low, and spreading the disease is even lower. So I think you should take comfort in knowing that at least the older kids are vaccinated. And my hope is that if your older kids do well, then as soon as it becomes available to have your younger kids get vaccinated, you should. That's a long answer to a short question, but pretty much if they are not vaccinated, you still have to adhere to the old rules with social distancing and being careful and mask wearing, that kind of stuff. And if there is exposure, they have to be tested and quarantined. Yes, that is all true. But that should not, I think on the contrary, it should actually encourage you to get your older kids vaccinated, because that is just one less, chance of your older kids getting the disease and then passing on to the younger kids.
Mm-hmm. And we've made a decision as a family that, as long as our 6-year-old isn't vaccinated, we're still going to continue to wear masks in public when we're out. Yep. I mean, if he has to wear a mask, we're all going to wear a mask until,
we do. I think I'm kind of silly too, that, a lot of the stores are now opening up where you don't have to wear the mask. I was in Hy-Vee the other day, and it says on the door that, if you're vaccinated, you don't have to wear the mask, and you walk in and probably 80% are not wearing masks. And I do trust that the people are telling the truth. I hope that they are, and they are vaccinated and that they're not wearing masks. I still had to wear my mask. I still feel that, I don't know if it's pressure or if it's a safety concern, which I know it's not, but I don't know what it is. But I still wear the mask in Hy-Vee. I think it's the same kind of thing, that I know that if I've got kids in my house that are not vaccinated yet, I'm still a little bit more cautious. But I need to get over that. I think I'm just used to the past 18 months of wearing masks out in public and at work, and so so I'm a little bit slow to do that. But yes, I agree with you. I think that if you have everyone in your household vaccinated, I think it's fair to take off the masks and adhere to the new guidelines from the CDC. But if they're not, then you still have to stick to the old ones. I agree.
So this kind of leads into our next question. After my child gets the COVID-19 vaccine, can we stop wearing masks?
Yes, you can. 2 weeks after your last shot, you're considered fully vaccinated, and you get to live free again, and masks off, and no more social distancing, and all those rules kind of go away, which is kind of nice. So yes.
And our final question is, what if my child tells me they don't want to get the vaccine? How do you have that conversation?
That's a great question. So my 7-year-old he's all about shots. He knows that shots make him stronger. They protect him. I mean, you've got to the dad who's a doctor, so he understands the value in vaccinations. But he's nervous about it already, and even though that he can't get a vaccine yet, he's already worried about when it's happening. So it's understandable. I think that you should ask the kids, why they're nervous about it. I think 90% more of that probably is just the fear of getting a shot in your arm. It hurts. It's a needle. It's a pinch. And so I think that's probably the biggest concern. I don't know if most of the kids are thinking about the benefits, the safety of the vaccine itself. I think they don't want a shot. I mean, every time I walk into a kid's room, the first thing my patient asks me is like, "Am I getting a shot today?" That's their fear. So I think having that discussion about why do you not want the shot, why are you worried about the shot, and if it's just the pain and just the shot itself, that's understandable, and that's you can have discussions about that, and we can do ice to the site. You can bribe them with a treat afterwards, and go out to the favorite restaurant, some ice cream or whatever to kind of get them through that. But I think depending on their age, going back to the fact that it's one little pinch and one little ouch for potentially a new life to live in the future. So I think if you want to go back to how things were and all the fun that we used to have without all these barriers and protections, then getting that one little shot in your arm is worth it. And I think having the discussion age appropriately, but have that discussion and address why they're worried, and then talk about the benefits of getting it afterwards.
And there are thousands of teens and kids who volunteered for the clinical trials, and so our kids aren't going to be the first to get the vaccine, and they're not going to be the last.
Correct.
You have to remind them of that.
So this is a safe vaccine. It's been studied for a long time, and yes, kids just like them were enrolled in these studies. Many kids have already had the shot too, and if you talk to other parents, like friends of yours that are parents, and if they've had, you can say, Johnny's already had his shot. His mom said he did fine with it, and peer pressure never hurt anyone. So I'm telling them that other kids in their class and other kids around the country/world have all had the shot too. And yes, it's an ouch, but it's a quick ouch, and the benefits much outweigh the pain of the shot itself.
Thank you, Dr. Schiffman. These are great tips on to get parents to start this conversation, parents and caregivers to start this conversation with their teens. Thank you.
Of course, my pleasure.
You can learn more about our pediatric ER and pediatric center at hcamidwest.com/pediatrics.